Hello, Namaste. Welcome to Dev's Hammer Show. This is a flagship program of Indigenous Television. Indigenous Television is Nepal's, in fact, South Asia's first and only Indigenous Community Television. Through this television, I try to bring the voices of Indigenous peoples from around the world and try to connect their successes and stories with one another. In this show, I conduct face-to-face interview or conduct online video conference. And I try to analyze various contemporary issues affecting Indigenous peoples. Today, I'm going to conduct video conference with public health experts who come from North Dakota, USA. And she is also program coordinator at First Nations Women Alliance. Hello, Miss Anna. First of all, I would like to welcome to the show and request you to introduce briefly about you and your community.
Nidosha nakbaga o madashi mia adasheds mabe sigids madzigidads nakbaga o. My name is Ruth Bufallo, but my Hidatsa name is my grandmother Ruth's Hidatsa name that I carry, which is Woman Appears. I'm originally from Mandaree, North Dakota, which is located on the Fort Berthold Indian Reservation, where I was born and raised. I'm a mom. I have 4 children, and I'm also a wife. My husband and I are small business owners. We own a barber shop, and I'm an independent consultant focused on public health. And I'm also a special projects coordinator for the First Nations Women's Alliance here in North Dakota. So.
You said that you were born and raised in Indian reservation. Indian reservation in US sounds a bit strange. Could you clarify a bit what sort of reservation is it?
My mother's tribes, which are the Mandan, Hidatsa, and Arikara Nation. So we are very north on the Missouri River. We're very close to the Montana border and also the Canadian border. My dad is from the Southwest, so he is a Chiricahua Apache. Right. Okay. So when we speak of Indian reservations here in the United States of America, it is comparable to a concentration camp. It's where our ancestors were placed into a small piece of land that we were starved intentionally, withheld from food and from practicing our religion. So these forts still remain today. There's a fort in Bismarck, North Dakota that is now a tribal college. And so a former tribal college president there said that this is where the Indians took over the fort. But so there definitely needs to be more work in getting the name changed, because Fort Berthold Indian Reservation still signifies the past wrongs that have been done to our people. And so I look forward to the day when we call it maybe the MHA Nation Homelands or something other than the Fort Berthold Indian Reservation. And the term Indian, as you may know, is that it was came from Columbus thinking that he found the far East India land, when in fact he was lost. And so the US federal government term used for our people is American Indian, but many today believe are moving away from that term and moving more towards Indigenous. So yeah. So lots of work still needs to be done over here.
I see. After listening you, I find almost similar stories of historical injustices that Indigenous peoples in Nepal have to tell. Could you briefly tell me struggles of your community?
Where I grew up on the western side of the state, because currently I'm on the eastern side. So where I currently reside is on the eastern side, which is closest to Minnesota. So where I'm sitting currently is on Ojibwe, Anishinaabe homelands. But on the western side of the state, along the Missouri River, is where my ancestors lived and where we currently live. So being along the Missouri River in the early 1950s, my grandparents their land was flooded by the U.S. Army Corps of Engineers for flood control for towns further down the river, including our capital of our state capital of Bismarck. And so that was a huge life-changing event for our community. 94% of our agricultural land is still underwater. The flooding of our homelands again displaced our people. They were at that time, before the flood, thriving, pulling their boots up by the strap, so to speak. You know, when people say, all you need to do is work hard, you just need to pull yourself up by the bootstraps. Well, our people were in fact doing that, but again had the rug pulled out from underneath them in having 94% of our agricultural land flooded. This flood disenfranchised our people once again. We went from one central community to 6 small fragmented communities. This affected our health. It affected our social economic status. Many people relocated to larger cities like Chicago, LA, and my grandparents fought to stay. But with that came a price. You know, where they relocated to after the flood was rough, barren, higher ground like grazeland. Many of our people were agricultural people, farmers, ranchers, but this flood tore our community apart. My mom had to go to a boarding school, and she was only 5 years old, and that was she was to be sent on the other side of the state. My grandpa tried to find work off of the reservation, but ran into challenges, and so later many of our people back home were changing their last name to a more English-sounding last name so they could find work. I have the court documents that say for the name change of my grandpa, it was for social economic reasons. So those are just some of the devastating effects that our people experienced not too long ago.
Like in your community, many indigenous peoples in Nepal also had to change their last name to be fit for the survival. At this time, I want to recall your conversations when we first met during Colombia visit. That time, you had told me that your work is focused on anti-racism. Do your community still face race-based discrimination?
The anti-racism work was kind of came to it peaked, I guess you could say, within this past year during the time of the No DAPL protests at Standing Rock. The consultant work that I did at that time focused on anti-racism. It was it was after the No DAPL protests, and we focused primarily on the Bismarck Mandan community, which is directly north of Standing Rock. So we worked on facilitating respectful conversations with people who may have been influenced by North Dakota media, North Dakota mainstream media. And so really trying to educate each other on our cultural differences, but also so yeah, the anti-racism work that I was doing there was funded through a grant from the Open Society Foundation, and it was focused on trying to change the narrative that currently is out there within our state of North Dakota that has been heavily influenced by North Dakota mainstream media. And so we brought together different people from across the spectrum of beliefs in North Dakota, but really trying to facilitate a conversation to where people from opposite ends of the spectrum could find common ground. to where, so this anti-racism work is definitely needed. And within this past year in North Dakota, the events surrounding the No DAPL protests definitely shined a light on an existing problem here in North Dakota that we face on a daily basis and across the country.
Mm. Media has a role to cover human rights violations, including such race-based discriminations. But many Indigenous peoples have different views in regards to the media coverage. What is your experience of media coverage in your community? Do media set negative tone against Indigenous peoples in North Dakota as well?
There's just a real negative undertone of against Indigenous people. Many different stereotypes of us breaking the law or being uncivil, and there's fear in the unknown, and so that heightens the gap between trying to come together. And so there was a lack of understanding in our cultural differences, and that really drove a huge wedge in between both groups. So with media, North Dakota mainstream media not fully understanding our culture, they took, there was some huge misunderstandings, and they took that and ran with it, and then it just fueled the fire, I guess you could say. It just it magnified, or it heightened these stereotypes that people hold against us. Everything from misunderstanding pipes, which are, something sacred, with tobacco pipes, those are prayerful parts of who we are. So that's one example of something that was taken out of context, and just also the relationship and the connection to the land. There were last year 2 years ago, during the 2016 election, one of our current U.S. congressmen had referred to the water protectors as climate worshipers. So there's just there's a lot of work to be done as far as educating others and coming together.
I see. Some of the panelists also raised similar instances during the panel discussions organized by Indigenous Media and Communication Caucus during the UN Permanent Forum on Indigenous Issues in 2017. One of the instances I recall that Indigenous communities in North Dakota were protesting. They were opposing against the access pipeline. Do you still face problems in Standing Rock in North Dakota?
From January to, I would say, April of last year was focused. I had an independent contract with the ACLU of North Dakota, the American Civil Liberties Union, and my role was more of doing outreach and listening to different leaders within the camp, the tribe, the state, all different governmental levels, in trying to see where the ACLU of North Dakota could assist. And so some of that also consisted of becoming a legal observer, to be there down at the front lines and to observe the situation, and also to observe law enforcement, because there were heavy reports and eyewitness accounts of the use of excessive force by law enforcement, that really drove a huge concern for human rights violations. The Dakota Access Pipeline originally was going to be placed north of Bismarck. Bismarck is the state capital of North Dakota, and Bismarck is located further north on the Missouri River. Standing Rock is south of the Bismarck-Mandan area. And so originally the path or the plans for the Dakota Access Pipeline were to be placed north of Bismarck, but the communities in Bismarck rallied together and shared their concern and distaste of having the pipeline north of their homes. So then the pipeline was then moved to north of Standing Rock, which is a Indigenous community, and also what others could refer to as people of color. So when we look at research and different trends, oftentimes our communities of color and that happen to be low income are often placed near environmental hazards. If we were to map that out across the United States, it would be very clear on where how close in proximity our communities of color are located to environmental hazards.
I see.
Public health is your expertise. When we talk about Indigenous peoples and their right to health, one of the major problems faced by many Indigenous peoples in developing countries is that they lack access to public health. What is the status of your community in regards to accessing the public health?
Young age, at the young age of 10 years old, I have 3 younger sisters and 3 older brothers and 2 older girl cousins that my mom raised. So we had a full house, a 4-bedroom house. And so, I grew up sharing a room with one of my older girl cousins. And their dad was my mom's brother, and he was killed in a car crash at a young age. And then my 2 cousins were in the foster care system, so my mom was able to get them out of foster care. And then my 3 older brothers also were in the foster care system, and then my mom chose to adopt them. And so she had them before I was born. And so my younger sister was 5 years old at the time, and she was misdiagnosed with a health condition, and so we almost lost her. And this happened within our small community of Mandaree. And so at a young age, seeing the gaps within our healthcare system really prompted me to want to do something and to change this. And so at 10 years old, I set out to become a medical doctor. And so I had, just having that experience firsthand and being an older sister, our role is always naturally to protect our younger siblings, and oftentimes I find myself standing up for my older brothers as well. My mom's tribe is a matriarchal tribe also, so it's not uncommon to have our women out in front or in different leadership roles, and so that's primarily why I set out towards a career in health, and public health is more on the preventive side of things. It's to try to prevent health conditions from happening. It's to prevent lives from being lost. So yeah, that's kind of the reason in short why I chose the health field. Are very heavy barriers to access to health, even access to quality health, because there's a stigma out there that Indigenous people within the United States receive free health care. Through the treaty obligations with the U.S. federal government, the health care that is provided through the Indian Health Services has never been fully funded. And so it's they are making improvements. They're working to improve the healthcare delivery of services, but within our communities, going to the Indian Health Services is oftentimes the last resort. There's many issues on all different levels within Indian Health Services, but the quality of care is very poor. And within our Indigenous communities here in the United States, we have such low life expectancies. Within my hometown of Mandaree, our tribal government is looking at lowering the age for our elders. To be considered an elder, they're considering lowering the age because a lot of our people are dying, are not living very long. And a lot of the health conditions that people are dying from prematurely can be prevented if we had access to good health care, if we had access to healthy foods. Stress is another contributing factor to chronic illness. Within Mandaree, we are coined as the heart of the Bakken oil formation. And so there's a lot of implications that will affect our health implications. During the peak of the boom, around 2011, 2012, we had a huge influx of population growth. We lost our baby sister to a drunk driver. And so that was a huge impact on our family. She was only 19 years old for a day, but the road that the car crash happened on was very narrow, and that road is a very deadly road. It was also referred to in the U.S. Forbes magazine as being one of the most deadliest highways in the United States. So we worked hard to get that road widened, to prevent further deaths from occurring on that road. But it took a lot of advocating, with the North Dakota Department of Transportation and other key stakeholders. So yeah, but again, our stories are not unique. There's many other communities that are facing pretty challenging times as well.
Apart from public health, what areas are you working with?
Currently, I'm working on a project focused on human trafficking in Indigenous communities. So we're traveling across the state of North Dakota, and we're holding community meetings to really get the feedback from the community on how they can help Indigenous human trafficking survivors re-enter the community.
Yes, you're right. Human trafficking is a global problem, but various studies show that women and girls from indigenous community are more vulnerable to this heinous crime. What do you think the major reasons of indigenous women and children to be victimized more than other general populations?
It's tough because I wish I had, all of the answers. I consider myself fairly new to the human trafficking arena, even the missing and murdered Indigenous women and girls arena. I started out more as a grad school student, volunteering and attending events and participating in that way. But since last August, incident occurred here in Fargo where a young Indigenous mother was 8 months pregnant, went missing. And that happened right here in Fargo. And so that was definitely an eye-opening, gut-wrenching experience to have witnessed. There are different protections that take place within the reservation currently from the reauthorization of the Violence Against Women Act, which is up for reauthorization here pretty soon. But what the reauthorization of VAWA provided was additional protections for Indigenous peoples within the reservation. So within the exterior boundaries of a reservation, there's protections. If a crime is committed against an Indigenous person by a non-Indigenous person, that non-Indigenous person can then be prosecuted by that tribal government or go to the federal level. But we're finding there are gaps within that system because many of us who live off of the reservation currently do not have those same protections. But to answer your question about human trafficking and why, there's a direct correlation with our relationship to the land, Mother Earth, and how our Indigenous women are treated. But within our country, our true history has not been fully acknowledged or recognized. And so we see there's much work to be done there in educating others, because within our cultures, as I mentioned earlier, some of our tribes are matriarchal or matrilineal, to where women are naturally held in high regard, whereas mainstream society, oftentimes, you see the gender gap, the income equality between men and women. You look at the disparities that are found there, and how that it's kind of women are here and men are here, but in our culture it's flipped, or it's flipped where we're equals. And so those cultural differences, but again, there's also socioeconomic reasons that come into play when we look at human trafficking. Also, with the Indigenous population in the United States only being about 8% or so, it's almost like sometimes people are surprised to see that we're still here, and so there's that component of our history being brushed underneath the rug and not really having respect for our people is also, I believe, a contributing factor. People think, we don't matter, and so you're not going to be missed because you're only 8% of the population, or there's just different opinions, I think, that can contribute to why we have human trafficking, or our Indigenous women and children are targets. So those are just some of the things that come to mind. Our history, the way mainstream society views women, but overall, I really believe that within the United States as a whole, our country promotes a culture of human trafficking.
We are almost at the end of the show. At last, I would like to request you to give one-line message to the world Indigenous peoples.
I would say not to give up, to continue working towards a stronger, healthier community, but we can't do it alone. We have to reach out to one another and partner and support one another. But healing from all of these processes is key. Really taking the time to reconnect with our culture and also our language, because if our language dies, then we're no longer here. So we really need to focus on our youth and listen to our youth. So yeah, never give up and really work together and really lift up our youth, and also, stay connected with our elders.
Thank you so much, Anna Ruth Bufallo, for your valuable time and esteemed thoughts that you shared with me. I have come to the end of the show. If you have any queries or feedbacks, you can reach me at indigenous-television@gmail.com. Next week, I'll be present in your TV set at the same time with a new guest. Till then, have a great weekend. Bye-bye.